Within military hospitals, coronary and cardiac CT scan is available at essentially all of the Army medical centers, and I speak for the other services as well. The major medical centers all offer that technology. Now, what we're still working through is ensuring that our beneficiaries have access to this important technology at some of our smaller sites, where they have a CT scanner, but they may not have the local expertise to do coronary CTs. And this is something that, it's really only been around 10 years. And if you think about, if you compare that to stress testing, which has been around for decades, we're still pretty new. So we're working to get the most modern scanners installed at all of our facilities, but quite frankly, that's really not the step. It's really just training and making sure that our cardiologist and our radiologist in the Army, Navy, and Air Force go out and have the expertise to do this correctly, because this is not your average CT scan. Okay, this takes a lot of pre-medication and patient preparation. You want to make sure you do it in the right patients, and so this is not something that should be done without some really important thought. And I think for us, the nice thing is that we have very detailed, what we call appropriate use criteria. And these say, here's the right person for a coronary CT scan, here's a person that's probably better suited with a standard stress test. So if you do it right, do it correctly, you pick the right patients, I think we've seen from our own program that you can really make a difference in getting people back to the battlefield, getting people back to their families, and understanding, I think, more definitively what their risks are and whether they have coronary heart disease. Well, I think the one thing the military has advantage of is obviously that for our active duty population, fitness level is something that is routinely assessed. And so, as you know, at least twice a year they undergo a fitness test. And so, of course, having that as part of their routine, I think, is very helpful. And it keeps people, I think there's certainly a motivation to keep healthy, to exercise, hopefully to keep your weight down within the regulations and do all of those things. But I think at the same time, obviously, just like in the civilian world, our military members are busy, and they struggle just like any American, finding the time to do that, fitting it into their lifestyle, making healthy choices at the grocery store, making healthy choices when you're busy at work. I think that's a challenge for every American, to include our service members. We know, looking across the military, things like smoking. The smoking rates among our active duty are about 5 to 10% higher than the average population of the same age in America. And so we've got a lot of work to do about educating our young soldiers about some healthy choices with regards to smoking, eating, and healthy lifestyle. So that's something that we probably need to do a better job of, or at least continue to really promote. Now, fortunately, all of our military health treatment facilities all have smoking cessation programs. I think over the last few years particularly, have done a much better job of educating folks about the hazards of smoking.